Just as the busiest travel season of the year arrives, guess what? So does flu season, right? Bringing in germs and viruses from all over the country.
In fact, the first flu-related death was recently confirmed in Los Angeles County. With us now is Dr. David Michalik, a specialist in pediatric infectious disease with Dignity Health St. Mary in Long Beach, to tell us how to avoid the holiday flu if we can. I think there is an attitude out there among a lot of people, it's just the flu, and that's the wrong attitude to have because it can be deadly.
Absolutely. You know, we definitely see people with extremes of ages, very young infants, children, and older individuals, those with chronic health conditions get the flu. It doesn't just potentially lead you to have illness at home. You can actually end up in the emergency room or get admitted to a hospital and potentially even be deadly.
So when should people start getting the flu shot? I was just talking to our producer, and she was saying that you mentioned a lot of people are kind of taking their sweet time. They're not getting on top of it yet.
Yeah, the activity in California and LA County specifically is still sporadic. Throughout the state, it's actually more widespread. But getting the flu shot should have happened, honestly, weeks ago, because it takes about 3 weeks for your immune system to rev up and maximize the protection against the flu. So getting the flu shot should be happening now.
Do we have any idea how effective this year's batch of flu shots is going to be? Because last year, not so much.
It's still too early to tell exactly. The predominant strains that are circulating across this country seem to be in the vaccine that we get, so there is protection against that. But where it all is going to end up at will develop as the season progresses.
Because you're just basically guessing, right?
Yeah, we predict which kind of strains are going to be circulating in the U.S. based on the strains that are circulating in the southern hemisphere. Australia had record numbers of flu cases during their flu season, and we're anticipating to have an increased number as well.
Okay, so obviously we're talking about travel and a lot of traffic, right, at the airports or even just out and about. You're encountering a lot of people during the holidays. What is your best advice to people, aside from just washing your hands as often as possible?
Well, if you're sick or you feel like you're sick, stay at home. That's going to be difficult to do when people are actually traveling, but if you are sneezing and coughing, try to cover up your cough with the sleeve of your elbow or without sneezing your hands. Try to avoid touching objects, magazines. Try not to share cups, spoons, straws, anything like that, and then stay at home from work if you're sick.
Don't touch your eyes, right? They always say that. Also, what about those things like airborne and some of those other things people use and they think it helps boost their immune system? Is that effective?
There's some mixed data on that.
Yeah.
Certainly, if you have any nutritional deficiencies, those are things to talk to your doctor about. I think some of the things, just hand hygiene and getting the flu vaccine, are far more effective than those, but that might potentially help.
What are the symptoms specifically of the flu, and does taking Tamiflu and some of the other things out there, is that really effective?
So the typical symptoms of flu are your typical runny nose, cough, congestion, but you can actually have fever, body aches, ear pain, headaches, and difficulty breathing. So if you start to feel those symptoms, then you potentially can ask your doctor to prescribe oseltamivir or Tamiflu, which can reduce your symptoms and the duration of illness.
Wait, so you don't necessarily have to get a fever? I thought that was a flu was associated with a fever at all times.
Many cases of the flu do involve a fever, but you don't have to have a fever to have had the flu.
Oh, okay, interesting. Okay.
Dr. Michalik, thanks so much. Really appreciate it. It's great to see you, and good information as always.
Thank you so much for having me. I appreciate it.
Thank you. Happy holidays.
And we'll be right back.